Hi everyone, and welcome to our first Oracle Cerner Health Conference and our first in-person conference since 2019. From down under, Department of Health, Victoria, Australia, you've traveled 9,000 miles and 24 hours to get here. And University Health, you've traveled 2 miles and 5 minutes to get here. And thanks to everyone else in between for being here. And particular thanks to the thousands of you that are attending online. We really appreciate your partnership. I'm David. The title of my talk is Now is Our Time. I believe this is our collective time. We all know the last few years have been really hard, but it's been pretty amazing to see what we can do when we start to work together. And looking inward, there's been no time in Cerner's history where we have been as capable and prepared and resourced to be your partner as we are today. Let's get to Oracle in a moment. But first, imagine with me what is possible. Imagine being a patient and walking into the clinic and they actually know you. They don't ask for your insurance information. They don't give you a clipboard. They don't say what came back in your test. What did the specialist say? Imagine that the doctor caring for you looks at you the entire time you're in the office. There's no computer time, literally no computer time. Imagine you actually went to clinic because your health app said, come in. So we can understand a recent change in your health. Click here and schedule at your convenience. And don't worry, this will likely just be a preventative visit. But the reality is that isn't today. Care today is rushed, transactional, reactive, impersonal. And that's not because us clinicians went into the field to work like this. It's actually the opposite. Caregivers are heroes. And in the last few years, we've seen caregivers step up among unthinkable death and tragedy. And they've done their very best, even putting their own lives at risk, to take care of us and the communities we live in. Heroes are supposed to have tools and superpowers that help them do their job. But the tools and the technology that we're giving aren't helping, they're inhibiting. Now, I've been at Cerner for just over a year, and I've had the privilege of visiting on-site with over 200 of our clients. My visits go like this. I get to meet with the C-suite, and then I meet with the IT department, then the CNIO, the CMIO, and then the tour. Now the tour is really nice. And all of you, and I'm privileged, I love seeing your new wing, the Cancer Center, the photon beam. But I have actually another desire on these tours. And so what I usually do is sneak away. And I go up to that person at the front desk in the ER that's really busy. And I say, hi, I'm David from Cerner. How do you like our tools? The feedback is mixed. And a lot of the issues are immediately addressable. Some of it's training, some of it's optimization, and some of it we're still working on. Later today, Travis and the team will cover this. But the biggest impression that I have after all these visits, everyone is sitting or standing in front of a computer. Very few people are tending to patients in an exam room or in a clinic. We have literally moved the exam room or the clinic to the terminal. Okay, let's take a step back. Now, we've accomplished a lot. Together, collectively, over the last 40 years, we've digitized the record. So no one here took care of a COVID patient in the ER or in the A&E and said, oh, we can't find this patient's chart because Dr. Smith took it home over the weekend. We fixed that part. No one recently has heard a pharmacist say, did this doctor write amiodarone or amiloride? Right? We fixed the legibility. Last year at this conference, virtually, I said that improving the EHR was the top of our list, the usability. That has not changed. We are going to build a system that is intuitive, more open, and more connected. What does more open and more connected mean? First is building it for the actual users of the system, the clinician. We're streamlining workflows across Millennium. You'll hear more about that. Second is modernizing our administrative solutions. We announced Revelate last year at CHC. This year we will share our progress. And third, we're getting all the data back to you in an actionable format. But this is just the start. On October 1 this year, we officially became part of Oracle. And now, as chairman of Oracle Health, I'm excited to share with all of you our plans. First, a little background on Oracle. Oracle is a global leader in databases, applications, and cloud infrastructure, having developed and run applications for some of the world's most critical industries, from finance to energy. 60% of the world's credit cards transactions and over 200 million health claims are processed by Oracle every year. Oracle, as you know, is a leader in AI with thousands of researchers, data scientists, and engineers. Okay. So we have the marriage of one of the world's greatest technology companies with the global leader in the EHR space. We've digitized the record. We fixed legibility. We're going to continue to work on usability. And together, Oracle and Cerner are going to allow you to care for your patients in communities like never before. Because I believe now is our time. We're going to provide you with a cloud-enabled health platform that is intelligent, connected, and interoperable. We're going to integrate the EHR into the supply chain. We're going to integrate the EHR into human capital management and integrate the EHR into enterprise resource planning. And it will be way, way, way less expensive than what you're paying now for all those components. Remember that imagine walking into the clinic and the doctor spending all the time with you and they knew you, and imagine the proactive preventative care that your app said? That's what we're building. Imagine a nurse is giving chemo for the first time. Just-in-time training is embedded in the EHR because the human capital management system knows this nurse and is connected to the EHR. Imagine your OR schedule drives your supply chain because your supply chain management is connected to the EHR. Instead of wasted inventory, your schedule predicts what you will need. Imagine AI and video proactively notifies a nurse to help prevent falls and pressure ulcers. This platform will make use of all types of data, like social determinants of health and other outside factors like traffic or weather, to drive more inclusive, actionable insights. Not only is this possible in coming together with Oracle, I would say this is our moral imperative. It is an obligation. We have the largest market share worldwide of any EHR company. And what I say to the team is that means we have more of grandma's blood sugar than anybody else. We need to keep that data secure. We need to get that blood result to the right person. And we need to make that data actionable. Understand if maybe grandma needs access to more nutritious food. To learn a bit more, I'd like to invite Mike Sicilia, who heads up Oracle's global business units, to the stage for a little fireside chat. Mike and leaders at Oracle have been great. They've approached this with incredible humility and passion, and I think you're going to really enjoy our few minutes together. Thanks, Mike.
Thanks.
And actually, before we get started, I want to tell you this was actually pretty hard to do because this is the time that Oracle's having its conference in Las Vegas, and Mike was in Las Vegas. He's here and going back to Las Vegas. So we appreciate
It's great to be at a health conference. You've given me a break from the cigarette smoke in Las Vegas. So thank you very much. Okay. I appreciate it. So, although there were a lot of people at the bar at the hotel last night when I got in, which was a little surprised by.
Right. So we'll have fun here, a different type of fun. So we've heard a few times now, Larry Ellison has said it, you've talked about it, that healthcare has become Oracle's primary mission. Yeah. What does that mean?
Well, it means we've put tremendous resource, specifically tremendous engineering resource, around creating better outcomes for patients and providers both. And frankly, we view that as the most important thing we've ever done in the history of the company. And we intend to fulfill the promise of making the EHR and making all the systems that surround it as usable as we possibly can, as quickly as we possibly can, and as safely and securely as we can. As we think about this mission, we're thinking about it holistically. And I think if you look at, or one of the things you and I have talked about rather, is that a lot of big tech, if you will, and tech companies have tried to, quote, fix healthcare, and they've all stubbed a toe or changed their mind. And our thesis on this is that the reason that's happened is because they haven't taken on enough of the problem. They haven't tried to fix enough of the problem. They haven't tried to fix the clinical systems. They haven't tried to fix the back office systems. They haven't tried to fix the staff scheduling, HCM, payroll systems, claims adjudication modules, point of care payment systems. And frankly, all of that, I think, and we think at Oracle, has been tremendously underserved by technology vendors. And the fact that we're willing to take it all on, I think, is the single biggest differentiator. Now, that doesn't necessarily mean that every one of your solutions has to be an Oracle solution in order to generate success and to generate better outcomes for your providers, for your patients. We will build this in a way that we have an open ecosystem so that the parts can be subbed in by partners, by competitors, if you'd like as well. But unless somebody really takes on that platform, somebody really takes on the definitions of all the APIs and all the things that have to happen to finally solve the IT problem in healthcare, I don't think there's going to be, I think all the other changes are frankly just incremental and not material enough to make a wholesale difference. So that's our vision. That's what we're focused on. You'll hear a lot more about it through the week here. You'll hear more about it tomorrow in the keynote that's simulcast in from our event in Las Vegas as well. We're excited to partner with all of you, and certainly in meeting with several of Cerner customers here in the past 6 months or so, it's been incredibly humbling for all of us to really engage with you on this mission to create these better outcomes, and we couldn't be more excited.
Well, it's fantastic, and I would add something else, and you just said at the end, my new Oracle colleagues have been uniformly inquisitive, humble, wanting to learn, and you've just provided us with amazing amounts of resources that we didn't have before. So Mike, your role is running all the vertical businesses at Oracle, and as we've gotten to know each other, there's been times where you've given examples, I'm like, wow, that would make sense in healthcare. So can you talk a minute about the life sciences business, what you've done for payers and governments, and how you think that blends in with what we're trying to do here collectively?
Well, as you know, I rarely do anything in a minute, but I'll try. We've been very active at Oracle in many vertical businesses for about 15 years now. We have a concept of business units that are vertically focused. Some of the adjacent businesses that are relevant here are life sciences business, where we have the single biggest pharmacovigilance database in the world. So last year alone, we supplied 91% of all adverse events associated with vaccines to the United States FDA, similar to regulators throughout the world. We've been in the clinical trial space for 14 years now, and certainly are number one or number two in the trials management space worldwide. 18 of the top 20 pharmas in the world use our solutions for everything from molecular discovery through trial management as well. But there are lots of other industries that I think are interesting. One is our communications industry. So we supply infrastructure today that routes 1 billion phone calls and text messages daily. So if you've sent a text message today and you've made a phone call today, you have absolutely, because it's on a U.S. network. Even if you're not based here in the U.S., you've used the U.S. network, you've run that over our policy routing, our diameter routing rails, which actually makes these things work and figures out when you push this button that you want the message to end up over here. Again, that happens over 1 billion times per day using critical infrastructure. Now, what does that have to do with healthcare? Well, that same critical infrastructure and that same fault-tolerant, mission-critical approach to creating highly scalable, highly secured systems will now become the underpinning of what we put underneath of Millennium, underneath of RevCycle, underneath of all these other solutions, so that they have that same, enjoy that same level of just, the stuff never goes down, right? I mean, it's really rare that you send a text message today and it doesn't go through. That used to happen years ago, but it really doesn't happen. And even if you looked at recent events with hurricanes and things like that, with portable antennas that are launched, the stuff still just works. And that has to be the paradigm that underpins all of what we build for healthcare as well. The other thing that I think is interesting there is from a 5G solution, there's a tremendous amount of telemetry that we can have, both in ambulatory settings and in hospital settings that don't involve cables and connections and routers and things like that today. I mean, we're working with companies today that are embedding 5G chips into medical devices that will turn medical devices into portable laboratories where you as providers have extreme telemetry into either the patient themselves or the results of that machine without any cables in between, without any Wi-Fi in between. It runs over 5G networks. So I think you're going to see a lot of 5G technology turn up. Then I think one of the other more practical examples is if you've checked into one of the conference hotels here, one of the hotels associated with the conference, you've used the Oracle Property Management System. And if you have a mobile key, if you use the mobile key for and hopefully your check-in experience went well, by the way, and hopefully everything was good. But every one of the conference hotels that sponsored this conference are all using the Oracle application technologies. What happens when you check into a hotel? Two things. Number one, they know who you are. They know if you've stayed there before. And they know if you can pay for it, right? Basically, because your credit card, you swipe your credit card and it instantly tells them whether you have enough credit. The same thing happens at point of care in healthcare. If you go to an urgent care, you go to an emergency department, we know if the patient can pay. We don't know much else about them, but we know that they can actually pay. Think about the experience that you have when you check into a hotel. They know how many times you've stayed there. They know if you like extra pillows, if you like something sent to your room, if you like to dine at the hotel or you go outside. All this intelligence that's built in there, all this contextual information is built into the portal that the associate is greeting the guest with. And we think that same paradigm can be applied with patient interactions as well.
So I think this stuff is amazing, and I think the audience would think, wow, this is great. And I know the next question that they all have, okay, so how are you going to do this? What does this mean tomorrow? How are you going to bring us along? And this stuff is great with, no wires, but I still got to run my operation, and we got a bunch of pain points. So how are we going to bring folks along?
Yes, how are we going to do all of it? So we're going to do all of it, first of all, with a heck of a lot of people, right? So we put a tremendous amount of people that we have repurposed from other parts of Oracle from an engineering perspective into the organization to do all of it. Some of it will be transformational, some of it will be incremental. And I think if we take it back to the EHR, we have an incremental approach on top of here that I think makes a lot of sense. Because what we don't want to do is put all of you in a situation to say, we've got the greatest technology, all that stuff that I just spoke about there. It all works now, it's all integrated, it's all beautiful, it's as easy to use as ordering something from your e-commerce site that you're all, but there's one catch. You've got to re-implement the entire system to get any value out of it. That's not such a great outcome. And I think if you look at alternatives in the market, that's exactly what you'll have to do, is to re-implement and create you'll have a data migration issue. We can do all of this on top of the core systems with Cerner for one reason. They're all built on top of the Oracle database. And since they're built on top of the Oracle database, we can incrementally add new web user experiences on top of. As you move to the cloud, as you move to web experiences, that should be as transparent to all of you as it possibly can be. I mean, will be a couple new things to learn, of course. There'll be a couple new things we're going to tell you, but we don't want to put you in a situation where you have to go through this huge reimplementation to get any value. That's why we love Cerner so much. That's why we think the acquisition makes so much sense in this marriage of us coming together with all this great technology. Cerner made a great choice in the database partner, by the way, with Oracle. Putting together all the great clinical expertise, we can do this in a way that we do it incrementally over time. You don't have disruption. You don't have massive retraining, issues, and you don't have a data migration issue, which is the single biggest problem in creating new systems. So that's why we're so thrilled to be working together. And as I said, you'll hear a lot more about it through the week here as we go.
Hey, Mike, we are thrilled, and thanks for your support personally and for the team here. We're really, really excited about our future together.
Thank you. And as I said, I'll finish where I start. This is the most important thing we've ever done in the history of Oracle. We're excited to partner with all of you. We thank you for your support. Appreciate all of your patience as we go through these, and your feedback has been great to date. We look forward to more of it as we go forward. Thank you very much.
Thanks so much, Mike. Perfect. Well, we got this collective mission now, and it's pretty incredible when you think about us coming together. Okay, so let's not forget why we're here. We're here for our patients, the patients you care for, to make our friends, families, neighbors, and communities healthier. That is collectively why we're here. When we talk about our future with Oracle, it only really matters if we get there with you by supporting you. This year's theme is people, purpose, and possibility. People means you, as clients, caregivers, and patients. Purpose, it is about delivering equitable, person-centered care and making it easier for caregivers to do their jobs. And possibility, now is the time. Now is the time to think big, accelerate our innovation, and work together to make healthcare more open and more connected. It's amazing what we can do when we love our communities and use data to care for them. As a physician, what makes me most excited about what we're doing is bringing clinical trials to everyone, everywhere. You heard where we're going from Mike, stating that healthcare is Oracle's new mission, enabled by a cloud-based healthcare platform, more open and more connected. We're advancing the EHR, and we can do so much more. It is all about people at the center of it all, providing better care to patients. That's our purpose. And there's no limit to what's possible. Now is our time. Thank you.